Welcome to the IntelliLearn video library, Regular Paediatric Weight-Based Orders, Part 2. In addition to ensuring that all of the required boxes of information are included on the order, paediatric weight-based orders must have 2 additional checks performed on them prior to administering any medication to the patient. Consider the paediatric weight-based order shown. The patient's weight can be read directly from the weight box on the order, and in this case is 5.46 kilograms. As a general guideline, the patient's weight is written to 2 decimal places if the patient is from birth to 1 year of age, 1 decimal place if the patient is between 1 and 12 years of age, and a whole number if the patient is over 12 years of age. Please be aware that this is not a national standard and may vary depending on local guidelines. The first important check to perform is to look at the dose calculation box, which shows the quantity of medication that should be given in each dose for every 1 kilogram of the patient's body weight, and ensure that this value is within an acceptable dosage range for the medication in question. You can do this by looking up the medication in a reliable and current paediatric dosing reference, such as a Paediatric pharmacopoeia, and checking its acceptable dosage range. In this case, the dose calculation for paracetamol is 15 milligrams per kilogram per dose. After looking this medication up in the Paediatric pharmacopoeia, we can confirm that this is an acceptable dosage range for paracetamol. The second important check to perform is to ensure that the dose has been correctly calculated for the patient's weight. The dose should also be rounded to 1 decimal place. This rounding requirement is not necessarily a national standard and may vary depending on local guidelines. The dose written on the order should be equal to the patient's weight multiplied by the dose calculation rounded to 1 decimal place. In this case, it is 5.46 kilograms multiplied by 15 milligrams per kilogram per dose, which is 81.9 milligrams per dose. The dose written on the order is 81.9 milligrams and has been calculated correctly. If the value of the dose calculation is not within acceptable limits for the medication in question, or if the dose has not been calculated correctly on the order, the medication must be withheld. If both checks are satisfactory and the order is valid, you can proceed with calculating the specific medication dosage to administer using the value in the dose box on the order and the strength of the medication. This process is taught in a different video lecture.